All right, looks like our participant pool has slowed down, so it looks like we've got just about everybody. So I'd like to welcome you to our little presentation webinar we have today, MFRPS 101. So one of the things that the Alliance Board has recognized is that there is always turnover and progression in our programs, and we see a lot of progression with program managers as well as new program coordinators. We get to meet a lot of the new program coordinators and managers at the meeting every year. And, oftentimes they come into the meeting, and especially in a year when we talk about change proposals and they don't have necessarily a really good background yet in all the standards. So we thought, not only to do this on an ongoing basis, but maybe start it off this year, just prior to the meeting and offer a webinar to newish, we'll call them program managers and coordinators, to just kind of go over the standards a little bit, talk about them, give you kind of the high points of what's required for those standards, give you that opportunity to ask some questions. We've got a good number of our Alliance Board representatives that are here and that are actually be presenting today, along with DSI staff from FDA. So we welcome everybody. Thanks for coming in and joining us today. Format's going to be probably the first, and we scheduled this for an hour and a half for the general session for everybody. And then we've got 30 minutes at the end just for program managers. First time we've run this, so we're not quite sure, again, the level of questions and things we're going to get. We will ask you to go ahead and drop your questions into chat if you have them as the people are talking. If we have time to take them, while we're talking about that standard, we will. If not, we'll go ahead and come back at the end, because at the end of each section, we do have an opportunity for Q&A. So we'll be able to come back around to those and we'll capture those. If we don't have time for whatever reason, we will make sure we get you some written answers back on those so that we get your questions answered and taken care of. We are going to record this, so just so everyone's aware, we have started the recording on this. We just want to make sure that some of the folks that were planning on attending that registered for this, if they're not able to because of work obligations, that we'll be able to make this available to them so they can still benefit from the webinar, even though they couldn't attend live. I would like to, Amy, if you can go ahead and switch over to our PowerPoint presentation. I would like to go ahead and introduce our speakers for today. Go all the way back to the beginning. You don't have the right presentation, I don't think. So look. No, you do. Never mind. I forgot I put that picture on the beginning. Too many things with the meeting coming up. So I would like to go ahead and introduce our speakers for today. Tressa Madden is with FDA with the Division of Standards Implementation. Hi, Tressa. We've got Robin Brown with the Maryland Department of Health. Robin is our member at large representative to the board. We have Rick Beckstrand, Food Program Director there in Utah, Department of Agriculture. Rick is the representative to the board for the WAFTO region, western side of the country. We have Jan Kelly from Minnesota Department of Agriculture. Jan is our NC-AFTO representative to the board, as well as our co-chair currently. Philip Fruching is with the Arkansas Department of Health. He's our MC-AFTO representative to the board. And then we have Sherry Morris, Pennsylvania Department of Agriculture, who's our CASA representative of the board. And me, for those of you that don't know me, I'm Pat Kennelly. I'm a program director with AFTO. In my prior life, I was the program manager in California for the Department of Public Health and oversaw manufactured food and our program standards. So I got a little bit of familiarity with the standards from my prior life. But welcome, everybody. We're glad to have you here. And without any further ado, I'm going to go ahead and turn it over to Tressa to kick us off with the first segment of our presentation. Tressa.
Well, good morning. I'm going to start off with discussing a little bit about the manufacturing standards. I call them MRFs. You're going to hear different terminology from different parts of the country. Some say MFRPS, some spell it out, but I personally use the word MRFs. That's what I've been using the last 10 years. So if I reference that, you'll know what I'm talking about. So the first slide here, the manufacturing regulatory program standards is considered a critical component in establishing an integrated food safety system. And with that, the MFRPS has established a uniform foundation for regulatory agencies for oversight on the food manufacturing piece of your inspection programs that you may have oversight with or be part of. So next slide, Amy. And so with that, we start talking about conformance with the standards. And the conformance piece is when the regulatory agency is continually assessing, evaluating, and taking necessary corrective actions, and when they address gaps and that they do not see something working. You write these SOPs, and a lot of times what you put on paper and what actually goes, what you actually do does not always match up. So as you review that, that's where you start looking to see for those gaps, and that's where we're looking for conformance. So next slide. When we talk about the standards, there are 10 standards that are established that have been developed as we developed this many years ago. And those 10 standards are, the first standard is the regulatory foundation. The second standard is staff training. Third is the inspection program. Standard 4 is the auditing of the inspection program. Standard 5 is reference to food-related illness, outbreak, and hazards response. And as we progress through this presentation, we'll define some of this a little further. Standard 6 is compliance and enforcement. Standard 7 is industry and community relations. Standard 8 is included with program resources. Standard 9 is program assessment of your program, and Standard 10 is laboratory support, and we start talking about ISO and non-ISO. So from there, take it away.
Okay, so the first standard is Standard 1, and that's your regulatory foundation. And the reason we have this standard is to evaluate the scope of your state's legal authority and what regulatory provisions that you have in your state to enforce food safety, enforce the manufactured foods rules, and also to compare to FDA's rules and determine whether your state's rules are equivalent or equivalent in effect, or in some cases maybe not equivalent. And that is important so that all of the manufactured foods in your state will be covered by either your state rules, the federal rules, or both. For example, in Maryland, we have most of our program, our rules are equivalent, fully equivalent to the FDA. However, there are some areas that we don't cover. We do not have jurisdiction over, for instance, dietary supplements, infant formulas, honey, and alcohol. That FDA does have some, that FDA does have jurisdiction over. So those are delegated or only regulated by the FDA in our district. So that's just one way that Standard 1 helps us be sure that we're covering inspection and enforcement within our state. Next slide. So Standard 2 is the training program. I have to say that formalizing a training program in Maryland was one of the most helpful things that the manufactured foods program helped us do. The reason that this program is important is that this is for new staff, for continuation, for continuing education, for all of staff. It helps make sure that there are training programs in place, documentation of the training that all staff receive when they come in. There's basic training to send you out to be able to send inspectors out to be able to do basic inspections, food warehouses, refrigerated food warehouses, advanced training to do things like seafood HACCP and low acid canned foods or acidified foods. There's a lot of documentation in Standard 2. There's a lot of appendices that need to be filled out. There's all of the courses that you would develop that are important for each of your staff. In Maryland, all of our staff do everything. So there's provisions in the requirements that allow you to say have less training for staff who only do say ambient food warehouses versus a number of other things that they might do. And then I'll turn Standard 3 over to Jen.
Hi, good I guess it's afternoon here in Minnesota finally too. Thanks, Robin. So Standard 3, there's a lot of stuff in Standard 3. There's a lot of components, a lot of different parts that you have to include in procedures and audit to in procedures as well. So Standard 3 broadly is ensuring that you have an inspection program that results in the reduction of foodborne illness, injury, and allergic reaction. That's always our goal. And that's associated with foods that are produced in your jurisdiction, obviously. So it's a system that you've established to inspecting firms to assess the compliance with the regulations identified in Standard 1. So there's 7 different components, and I'm going to go through those really briefly, I think. The first one is establishing a risk-based inspection program. And the first part of that requirement is having an inventory of the systems in your jurisdiction. So this could be firms that you license, maybe you don't license, maybe you have registrations, or maybe you have something different. One complication that we found here in Minnesota is that we have licensed firms, but we have some firms that are exempt from licensing due to language in our state constitution. We still needed to include those firms in our inventory, and we hadn't been doing that initially. The second part of this part of the standard is to have those firms classified or categorized by a risk that's related to something that might happen at that facility with their processes or with the products that they're producing. And then also an assignment of inspection frequency based on the risk. So there's a variety of ways that that can be done. They might be designated as high, medium, or low, or maybe you have a numbering system. And then, of course, FDA's system is high and non-high. And sometimes that is a challenge between a state system and that FDA system. The second component of Standard 3 is an inspection procedure. So this is where it gets into, there's a lot of stuff. So there's defined elements. I'm not going to go through all 22 of those elements, but sometimes it's easiest just to include the language that's in the standard in your SOP. And that might be in one SOP, or it could be in multiple SOPs, depending on how your system works or how you choose to break it apart. The third component is inspection reporting procedures. And again, this might be different depending on if you're still handwriting reports, or might be dependent on an electronic inspection system that you might have. But it talks about timely submission and documentation of violations and observations, and making sure that inspectors are following up with corrective actions that the firm might have taken, but also the compliance and enforcement actions. So there's a tie-in to Standard 6. So that covers more about what the enforcement actions are, but that part in Standard 3 is about having a procedure to follow up on those things at the firm. The fourth component is having a recall procedure, and that includes sharing information with other agencies, making sure that recalled product is removed from the marketplace. So how do you look for that during inspections? And then a component of recall audit checks. So again, this might be in one SOP, or it could be in multiple SOPs. Here in Minnesota, that part of Standard 3 is actually managed or overseen primarily by our rapid response team staff. The next component is about having a system for receiving, tracking, and evaluating consumer complaints. So this might be something about a specific facility, or it could be about a food product. And we all know that a lot of times we get complaints about things that are not relevant to our jurisdiction. So that's where it's important to have a connection, have something in your procedures that those do get referred off to the appropriate agency. And if that's in another state, that might just be sending it off to FDA for follow-up. Number 6 is about industry complaints about inspections. So again, having a system for tracking them, evaluating, and responding. So those complaints might be about a specific inspector. Say maybe it's about their behavior. And sometimes those are HR issues, and maybe you don't want to have a procedure internally in your program. But it might be about the way they assess something at a facility. So here in Minnesota, we call that an appeal, and we have that in our statutory requirements that firms have the right to appeal. So we have a procedure set up to address those appeals. The last component is about sampling procedures, and this wasn't initially in the standards. Sometimes I think there's the thought that sampling goes along with laboratory procedures, and in some states that might be true, but in some states it's not. So here in Minnesota, the inspection staff are the one that collect the samples, but then obviously the lab does the analysis. There's a lot of different components in that sampling requirement. Additionally, there's the requirements for records retention, and every standard is going to have a records retention section. So just be sure that you're looking at all those different appendices and so forth that you need to keep related to Standard 3. Next slide, Amy. So the other standard I wanted to talk about is Standard 4, and that's kind of what we think of as the auditing standard. It's a way to have a systematic evaluation of your inspection and sampling programs to make sure that the quality is there, and as well as making sure that those different audits are occurring. It's a quality management system. I always say to my staff, if a quality management system is a good thing for our industries to have, it's a good thing for us to have as well. So there's 3 main audit types that are included in Standard 4, and that's the field inspection audits, inspection report audits, and then sample report audits. For the field audits, that's where someone goes out, a qualified trainer or a qualified auditor, to evaluate what the inspectors do. Now, in some states, that might still be happening by FDA. Maybe you don't have it set up to do that internally, and that's fine, and you can incorporate that into how you complete your appendices. There's a requirement for 2 field inspection audits every 36 months, so there's a lot of date tracking that has to go on there as well. Note also that there's some overlap there with your contract work, and so just make sure that you're having good communication with your state liaison. I know there's been a lot of efforts to try to harmonize the field audit requirements with the contract as well as what's in the standards. For the inspection report audits, that's a sampling of audit or inspection reports that needs to occur periodically. You get to set the period. Note that not every report has to be audited. It requires a random selection of inspection reports, and there's a table in section 4.3.3.1 that talks about maximum and minimum numbers of reports that have to be audited. Sometimes supervisors might be looking at reports and they might be the auditor, but sometimes that might be assigned externally as well. And also then there's the sample report audit. So it's not about sample collection, but it's just about looking at the report. So there's no field component on this one. And are they being collected appropriately? Are they being recorded appropriately? And there is a lot of different components there as well. But this is a desk audit, and you can choose to do that again monthly, or you can do it over the whole year. Something that I would recommend with both the inspection report audits and the sample report audits, excuse me, is that you don't wait and do that on an annual basis, that you do it more frequently. Maybe not every month, but maybe quarterly. And the reason for that is that if you wait till the end of the year and then find out that you're going to be out of conformance because you've had too many needs improvements marked, that doesn't give you an opportunity to make those corrections. Whereas if you do it on an ongoing basis throughout the year, you can make corrections, retrain people, rewrite procedures if the procedure isn't directing people to do it the right way. And then, of course, there also is the records requirements that are included in Standard 4 as with the other standards. There's a lot of appendices associated with Standard 4 for not only capturing the results, but doing that analysis for making sure that they're in conformance for all of those different audit types. Right, I think up next is Rick Beckstrand from Utah.
Thank you, Jan. Excuse me. So good morning to everyone out there. Good morning or good afternoon, depending on where you're at in the country. Today I'm going to be talking about Standard 5 and Standard 6. So Standard 5 is our food-related illness, outbreak, and hazards response standard. Some of the nomenclature now is food-related incidents, so that's supposed to capture all of that. If you read the definition for food-related incident. But I'm going to be spending a bit of time on Standard 5 today because this is a big standard. There's a lot to it. And I'd like to start out with an example of how these standards really help state programs to improve and up their game. So back in 2012, we enrolled in the standards as the state of Utah. And we didn't really get started until 2013 with implementation. And really, we were deer in the headlights, clueless at the time. We didn't even know what we didn't know at that point. And the one thing we did know is that our ability to respond to foodborne illness outbreaks and food incidents we really needed to up our game in that area. So we actually started with this Standard 5, and started implementation efforts. And we worked for a couple of years to get our policies written and, make sure that we had all the training in place and we were capable of trace back and trace forward and sampling, recall, effectiveness, environmental assessments. So over the course of that couple of years, we were making big improvements in our ability to respond to foodborne illness outbreaks in the state. And in 2015, along came a big outbreak, Salmonella Puna, if you all will remember. That was quite a large outbreak nationally. Utah was hit particularly hard by Salmonella Puna. I think we ended up with the third highest number of cases in our state, in a state that only has 3 million people. So, we really needed to make a good response to that outbreak. And that 2 years that we spent working on and making improvements really helped us to respond and helped us to be able to, make a real difference in helping to solve that outbreak. We were able to sample cucumbers in a big distribution facility here in Utah, Associated Foods that was distributing contaminated cucumbers to other parts of the country. We worked with some of the other states, Idaho and Utah, who were collaborating with us because they had associated food stores in their states that were generating some of these illnesses. And so, the sampling we did at the big warehouse here, we were able to find a lot of those cucumbers that were coming through the distribution in San Diego. And those were all found to be positive. They matched the outbreak strain. And further testing, whole genome sequence showed they matched the clinical isolates. So that was a big win in that outbreak, because we had upped our capabilities to the point where we were able to do the sampling. We also conducted a trace forward investigation to get out and find all of the cucumbers that had been distributed going forward into the commerce. And we were also able to conduct environmental assessments at a lot of our facilities in Utah that were still trickling in cases even late into the outbreak. So that really showed us, what can be accomplished if you really take these standards seriously and, implement them and eventually gain conformance in these standards. So let's just jump right into Standard 5 here. So the overarching goal for Standard 5 is for the state program to have written procedures that outline a systematic approach for the detection, investigation, mitigation, and analysis of food-related incidents to stop and control the outbreak or incident and prevent the identified hazards from causing future outbreaks. So key elements in that are, number one, coordination of foodborne illness outbreak and hazard responses with other agencies or programs. MOUs may be required if other state agencies also have responsibility for foodborne outbreak investigations. For example, it's most common that the state public health department is responsible for disease surveillance and monitoring and, finding those clusters of illness, identifying a food product and then, sending that information, relaying that information quickly to those who will conduct the field component of the investigation, which is generally, State's Department of Agriculture. Sometimes states are set up differently than that, but that's the most common. For those field investigations where traceback, environmental assessments, or sampling at food facilities may be required. And MOUs are an important component of this because they help define the different and assign the different roles and responsibilities between the agencies. So we have a pretty large MOU with our other state agencies here in Utah. Another key element is written procedures. So states can do this different ways, and many states have a FERP, a food emergency response plan, that covers all the components of the standard. Or you can have multiple procedures that address the different areas that are required in the standard. These procedures need to describe the program's roles and responsibilities, how investigations will be jointly conducted with FDA, and identifies response coordinators and how other relevant agencies, including law enforcement, are notified and how key contacts lists are maintained. So our state is one that has multiple. We have 7 different policy and procedure documents that guide our response actions during food-related incidents. And there's no right way. It's what works for your state. Another element is that it needs to use epidemiological information to detect food-related incidents, including foodborne illness outbreaks, maintains program notification of outbreaks and incidents in a log or database. Also needs to use established procedures to investigate food-related incidents and uses C4 guidelines for conducting outbreak response. The brand new iteration of the C4 manual has just been released, and I can tell you, we really rely on this here in our state. It's a great manual. It's a collaborative effort of many of the food safety experts throughout the nation, and it's a great guide. So using that to respond to outbreaks is helpful. Also conducting traceback and trace forward activities of foods implicated in illness, injury, or outbreak, and maintaining access to laboratories for analytical support, and evaluating environmental assessment data to identify contributing factors and antecedents that led to food contamination. So I find that a lot of folks that I talk to are still a little bit nebulous about environmental assessments. So if that's the case, I would recommend the CDC training, EATS 101 and EATS 102. It's right on the CDC website, and it's been down for a number of months, but the Eats 101 is back up and live. And so if your program is interested in really learning the nitty-gritty of how to conduct environmental assessments and why those are done and how they differ from actual inspections, that Eats 101 and Eats 102. If you go to the CDC website and just put Eats 101 in the search bar, it'll take you to the page where you need to register for that training and take it, and it's very good. Also, shout out to NEARS, the National Environmental Assessment Reporting System. It's something we're registered for here in our state, and it gives you a mechanism to upload your environmental assessment data to the CDC so that they can create a report that it's a real comprehensive report that they send out at the end of each year. So another area is initiating control measures to contain food-related illness and hazards and maintain a written procedure with criteria for releasing prevention guidance and information to the public, and maintaining investigation and environmental assessment findings and reports and distributing reports to relevant agencies. If recommendations are available, they are distributed to relevant agencies and stakeholders to help prevent reoccurrence. And again, you can break these things down into separate policies, like release of information to the public is one standalone policy that we use here. So it doesn't matter how you decide to do that with your state. It's what works for your state. There's a whole list of required documentation that you need to keep. So the self-assessment worksheet, standard Appendix 5.1, an MOU if it's applicable to your state based on how you're set up, written procedures for coordination, surveillance, environmental assessment, control measures, and post-response, and then records associated with coordination, surveillance, environmental assessment, control measures, and post-response. Also logs or your database that you use to track notification of food-related incidents, and investigation and environmental assessment reports and summaries. So that's the high-level overview of Standard 5. So if you'll, Amy, move forward to Standard 6. So Standard 6 is the compliance and enforcement standard. It's also a standard that's really helped us up our game in our state. We did not have a written compliance and enforcement program as we went into implementing the standards. So this is something where we have a written program. Again, you can use different policies and procedures if that's what works for you. This one we have into one document that's a written program. The overarching goal for Standard 6 is for the state program to have a compliance and enforcement program that has written procedures to ensure that compliance actions are supported by sound judgment, adequate evidence, and appropriate documentation. Key elements for this standard include written procedures or a program that contain compliance and enforcement strategies, and describes procedures to monitor critical violations, chronic violations, and chronic violators. So there's an area where we struggled with, how to monitor and track, especially the chronic violations. The criticals are a little easier. There's fewer critical violations. And so we, when we had one of our first audits, our auditors decided that they didn't like our manual tracking system for chronic violations. So we decided that a technology solution would be appropriate. And so we were able to put together a technology program that helps us track. And we also do something that's kind of unique in Utah. Our inspections are graded. So grades A through D. And it's not because we want to embarrass anybody. It does help us with enforcement, but it helps us in a lot of different ways, including being able to track and monitor So I look at this grades report in the morning, each morning, and it just gives me a crystal clear instant picture of where we need to start our enforcement efforts based on, who's getting those C and D grades that trigger follow-up inspections and other enforcement actions that need to be taken. And then as far as the chronic tracking, that's been a little difficult for a lot of states to figure out how to do that. We have a chronic key on our inspection system that inspectors, when they hit a chronic violation, and there's a whole set of triggers that have to be there for us to. The first thing you have to have is just a really, really good definition of what you consider a chronic violation. We have ours, and based on that, our inspectors are allowed to hit that key if they feel a violation is chronic. That helps us generate a report that identifies the chronic violators and also trends where those violations are. And if we start to see a trend, that allows us to then start to develop, some outreach, education, and training to industry if we're seeing those trends. So that's something that's really, really helped us with compliance and enforcement. We used to have troubles just being on time with our follow-up inspections, and we haven't been late on a follow-up inspection in over 2 years now, based on the control measures we've been able to put in place and based on the standard 6 requirements. So another key element, it uses a risk-based process to determine when a directed investigation, follow-up, or re-inspections are needed. I'm not sure how many people are using that directed investigation terminology now. I kind of relate those to environmental assessments, but I think there still are issues where you could call something a directed investigation. Also, it needs to establish a framework for progressive compliance and enforcement actions, and it needs a system to communicate policy and guidance to staff. So Standard 6 also requires performance reviews of compliance and enforcement actions that must be conducted annually. Appendix 6.2 is utilized to document the evaluation of compliance and enforcement actions to ensure written procedures were followed. Results should be used to identify improvements and modify procedures. If conformance ratings fall below 80%, a corrective action plan is required. There's some changes coming up on some of these items here, but we won't go into that today. This is the standard how it sits today. Required documentation includes Appendix 6.1, the self-assessment worksheet, written compliance and enforcement program, or policies and procedures, and Appendix 6.2, performance review of enforcement actions or equivalent form. So there's Standard 6. And at this point, I would like to turn it over to Philip for the next standards, 7 and 8.
Thanks, Rick. Hello, everyone. Today, we're going to be talking about Standard 7, Industry and Community Relations, and Standard 8, which is your program resources. Standard 7 works with everything that you do to communicate what your program is doing to industry, regulators, academia, and consumer representatives, and also how you use to coordinate or participate in outreach activities that provide educational information about food protection topics. You want to make sure that you've got a written procedure that contains information on how the program will communicate with food industry stakeholders and consumers. So you want to include the methods, how you're going to communicate. Are you going to use newspaper ads? Are you going to do radio ads? Are you going to do TV shots? Those types of things. Are you going to coordinate with your communications team in your agency? How are you going to interact with industry and consumers by sponsoring or participating in meetings, task forces, other types of things? Are you going to tailor outreach to targeted populations? Rick just mentioned that he was tracking and trending, so he could tailor outreach to those establishments that may need some extra communication guidance there. You want to document and evaluate your research and outreach activities. Make sure you're doing some kind of of an evaluation if possible. If you're doing, some kind of an educational forum, something like that, make sure you're keeping your agendas, meeting minutes or other documentation to be maintained so you can actually write it down and prove that you're doing those outreach activities throughout the year. Again, have your written procedures to communicate, and then complete that self-assessment 7.1. Okay, Amy, next slide, please. The Standard 8 talks about your program resources. It requires the state program to conduct an assessment for if you have enough staffing, equipment, and funding, and make sure your staff has the right equipment, what they need to do their job. There's a couple of sheets, 8.2 and 8.3, which is your equipment list and your staffing and how you can calculate staffing. It's pretty good. So you want to make sure your calculations to determine the number of staff required to complete inspection work based on your inventory, your risk assignment, and frequency. So as you see, all of these standards that we've talked about so far, they're building up to the last few standards, and this is one of them that you take all that stuff that you've done in those previous standards and you populate them into this particular standard. For the equipment list and things like that, I know when I have new staff, I'll do an equipment list, so I'm issuing that to them, and periodically do checks to make sure that they still have the equipment that was issued to them. And if I issue anything new during the year, one of the things we purchased recently, we do a lot of refrigerated warehouses, and my staff was complaining, we need coats. So we got them coats and hats so they could do inspections in those freezers. So you just want to make sure you've got the equipment, the staff has the equipment, and you're documenting that you have the equipment. And again, you're wanting to use your Appendix 8.1, 8.2, and 8.3. And with that, these are two short standards. I'm going to turn it over to Sherry.
Thanks. Good afternoon, everybody. I'm going to talk a little bit about Standard 9, which is the program assessment standard. So the main goal of Standard 9 is, like any good continuous improvement process, it's going to drive you to do periodic self-assessments of your program against the standards. And it's also going to require you to develop a strategic improvement plan to fix any non-conformances or deficiencies that you might identify in your program, but also to use the strategic improvement plan to drive a continuous improvement process as well, even if you don't have deficiencies or non-conformances. So sometimes I often wonder why this standard actually ended up at the end, because if you're a new program developing trying to conform with this standard, the first thing you're going to do is basically do a self-assessment your very first year of each of the other 9 standards to see where you fall, whether you actually comply with them or do not. So as a new program, this is probably your number one goal, is to complete this program assessment exercise. Once you have done that, there is a summary in Standard 9, as well as all the worksheets and the other standards. There is a summary report of where you fall as far as conformance in your own self-assessment against the other 9 standards. This standard also does require that you have some type of written document control plan that as an example, in Pennsylvania, we use SharePoint to make sure that all of our field staff and all of our management staff have access to the most current document for any given situation. It has the most current protocols we've developed, as well as any forms that we might use in carrying out our duties under our programs. So the standard does require that you come up with some type of way of making sure that all your written protocols and documents are all current throughout your program staff and that they're fit for use at any given point in time. So you have to be able to demonstrate that somehow. Again, there's no set way. Like we in Pennsylvania, we use SharePoint because it's an online program and anyone can access it at any given point in time. But there are other ways out there of complying with that requirement. The program assessment also does have an element in it that speaks to retention plans. I think you've all heard that mentioned in almost every other standard. But under Standard 9, you do have to have some type of retention policy. Whether the standard does require 3 years, but many states have other retention rules. I know in Pennsylvania, our rule is 5 years, so that's what you would find in our standards, our program assessment standards. So just be aware of that. You do have to have some type of retention plan. As far as the strategic plan, that's another element in the standard. The strategic plan is defined and has to contain certain elements within that plan. So if you do have a nonconformance or a deficiency in a particular standard or a standard element, you would need to define what that element is, spell out your improvement initiative that you're using to address the deficiency, put down the actual date that you're saying that you're going to complete that correction, who it's assigned to, because that's important. A lot of times we know we need corrections, but the project or initiative never gets assigned to a particular person to shepherd it through the process. So the strategic plan does require a person assigned on it, and then you would actually log dates completed when you do complete your initiatives or projects. Again, early on, when you're first developing the program, your strategic plan is probably going to be mostly about correcting deficiencies or nonconformances. As your program grows, I know, we've been in the program in Pennsylvania for 10 years, so we've been conformant with 9 of the 10 standards, and I'll talk about standard 10 in a minute. But, as your program grows and you do become conformant with standards, your strategic plan will become more about continuous improvement, trying to look on a routine basis at your program and how you can keep improving it and not necessarily, and going above and beyond maybe, and not necessarily just conforming with the baseline. And as we all know, as time goes on, probably things will change and you'll change how you're doing things. So you might end up developing new inspection reports or maybe coming up with different ways of doing enforcement. So all those activities you can document on your strategic improvement plan as continuous improvement initiatives. The other element that's in this program assessment is that you will participate in Fda assessments or audits of your program. So that occurs routinely. Once you're conformant, it is every 2 years. So though the element does require that you participate in those audits and that you make corrective actions based on FDA's assessment of your conformance with the standards. So with that, I will, Amy, standard 10. So standard 10 is all about your laboratory support in your program. But I will say in Pennsylvania, this is probably was for us the most difficult standard to meet. It's going to vary a lot between programs. But the whole point of the standard is that you have a laboratory that can support your regulatory program. That laboratory is going to be able to do food and environmental samples as well as as well as clinical samples, if that applies to your program. If that does not apply to your program, then you don't need to address that. So, for instance, in Pennsylvania, our food regulatory program does not do clinical samples. They're done in our Department of Health. So we do have an MOU as far as outbreak response and so forth, but our Department of Health is responsible for clinical samples. So you would only need to address that under this Standard 10 if it falls under the realm of your laboratory's responsibilities as far as your regulatory program. Again, I will say this is probably one of the most difficult standards to meet if you have your own in-house laboratory. The standard does require, again, that you do food and environmental samples at minimum, clinical samples if that applies. You do need to maintain a list, the laboratory does, of what routine and non-routine analysis they're capable of doing. And then the biggest thing is your laboratory does need to be either ISO 17025 accredited, or they have to have a system in place in the laboratory that basically meets the same ISO standard. So alternatively, if you do not have a laboratory in your own regulatory program, this standard would require you to contract with an external lab that would meet those same standards. So that is the other way, and I know there are several states that have done that is the other way of complying with Standard 10 if you don't have your own internal lab, is having contracts or written agreements with other laboratories that would act as your regulatory lab. Just anecdotally, just to share what happened in Pennsylvania, we do have our own regulatory lab, and like I said, this is probably the most difficult standard to comply with if your laboratory is not ISO accredited. We did have a good laboratory program with many of the elements in place as far as documentation and participating in proficiency testing, sampling, but our laboratory was not ISO accredited. So this requirement is lengthy to prepare for, to go through an accreditation process. It does also cost money and resources, which was what delayed Pennsylvania from complying with this. It's very difficult if you don't have a quality system and quality management staff in the laboratory, which is really what we were lacking. So of all the 10 standards for Pennsylvania, this has been the one that's taken the longest. It took us almost 5 years to comply with this standard. So it's not something that's typically going to be real familiar to MFRPS coordinators. You will have to involve if you do have an internal lab, your laboratory staff, because sometimes it's like a foreign language with the two groups speaking to each other. So it does require a lot of cooperation and coordination to comply with this standard. With that, I will turn it over to Tressa to talk about some of the challenges for coordinators.
I wouldn't call it challenges, but so the next piece with this, what out of my area within the FDA office is the Office of Partnerships, and this is where the resources or the funding to support these programs come about. But in the past, as everyone mentions, over the past 10 years, we've had multiple ways of supporting these programs because it does take staff, it does take time, and it takes a lot of effort to be able to meet these standards. And in the beginning, these resources weren't available, and you couldn't move forward without the help. So things have adjusted and kind of changed around, but what we now call it is the FDA's flexible funding model. And with that, there's a baseline on determining on the size of your programs, because we had large programs versus small programs applying for resources, and the award, the way it was set up, everyone was given the same amount. And to make it more fair and make it where we could share more money and be able to support the programs, we come up with what we call the flexible funding model. And with that, there's a baseline, and we'll get a little bit into that here in just a minute, but there's multiple tracks for applying for the money. The base award is being enrolled in the standards, the MFRPS, And then with that, if you have an RRT, rapid response team, that there's an opportunity for funding for that, or you could develop an RRT depending on where you're at within the standards piece with this. Multiple states have food safety task force. There's opportunities to support that. We've got special projects. In the past, that's been kind of limited because states were trying to actually meet the standards or be in full conformance before they started taking on special projects. And special projects could be, oh, I'm in full conformance now. I have this great idea that hey, I want to work with a county or a different program and come up with something to support our state or whatever it chooses. You want to do training. You can come up with anything you can imagine that supports the general compass of the 10 standards and apply for resources for that. This past year in 2020, we added preventive controls because with FSMA, that is now a piece of FDA on preventive controls implementation. And so we had an expansion, and it was a one-year piece with that. What's kind of interesting, what I'm seeing is within this next year, with not being able to do inspections and like we have in the past and some of the other places where we've spent money for travel, there may be some opportunities for some additional one-timer kind of things like this may come up here in FY21, if not FY22. So you may see something pop up with that. But anyways, there's a base award piece with that. The optional pieces are the ones I mentioned. And next slide, Amy. This is a slide that kind of shows you the base funding piece with it, the development stage or the maintenance stage. And when you're at maintenance is when you're considered that you've met full conformance. But the base piece, depending on your size, as it notes, you can get up to $300,000 for 5 years per year to be able to do that. And then when you come maintenance, as you see, there's level 1, level 2, level 3s, depending on the size. And then you start adding on these optional funding pieces with this. I'm assuming we're going to provide these slides to everyone. There's links in there to the area to apply for the grants or the cooperative agreements or look at the funding opportunities that come about, and we can share that. It's not specific in the slide, but we'll make sure you get that. And then this little chart is a good piece of information to have, so you can kind of look and see what you're available to do at the size of your program and what you can and can't apply for. So next slide, Amy. So with the flexible funding model, the preventive controls for human food piece with us, this track was added in 2020. It's a supplement. Actually, the dates on that, you're going to go to grants.nih.gov and look this up. And if you're interested, this is the piece that you can incorporate preventive controls into your program now if you're expanding your program to conduct those types of inspections for FDA, or you're going to enhance your own program there. If you're adopting some of the FSMA rules that is beyond just the basic GMP pieces, this is opportunity there. The preventive control piece, the regulatory program, and the track funding. So this is all to enhance your foundation. If you need help with legislative research, if you need rule support, statute modifications, any of these pieces, you can apply for this because it takes resources for staffing, if you're needing to go talk to your legislation about it, if you're going to Board of Health. All these is cost prohibitive for, and specifically right now when we have all these restraints and a lot of the state income situations with sales tax and all that, all this falls into place when you start talking about needing resources and to get some of these rules approved. And these are opportunities here to give you some ideas how to support that. And you can always go back to your DSI person and they can give you some ideas or give you suggestions from another state or another program that they've seen or they've helped get some information to help you move forward or give you some ideas on how to apply for this and what they're using their resources to do. So next slide. So the FDA Office of Partnerships is what we are considered part of. The Division of Standard Implementation is what I am, and that's within the Office of Partnerships, but we have the Regulatory Program Standards Development Crew. There are 4, we're in the process of hiring a new person, 5 people in the manufactured piece. There are 3 people within the animal feed, and then egg and egg product is a new set of standards that is actually right now being processed through the Office of Management Budget. A new set of standards that is coming out for all the programs that may be doing an egg inspection or do it, and they may not be doing it for a contract. We've got several states that do that, but maybe part of your Department of Ag that you have an egg inspection program that may be an opportunity for you to develop the standards within your inspection programs within your state and expand, and hopefully there's opportunities for funding to support these standards later down the line here. But with this, there's technical advisors, and that's kind of what we're considered with. We kind of help with the education and outreach to promote the animal feed and the food standards. We're part of those 2 groups. The Alliance is the group that's sponsoring this call today, and then there's the AFCO, which manages some of the feed standards. In some state programs, depending on what you are, ag or food, you may have regulatory. You know, if you've seen one state, you've seen one state. So every program has a little bit different authority on what they inspect or what groups they're associated with. So this is kind of in general for all 50 states, but depending on your state, what you're available for. We actually review some of the cooperative agreement deliverables. So when you have to complete all these, the person that's looking at the report really doesn't know what all the details are on this. So at this point, DSI, we review that because we've got enough contact with the state programs and we do our visits. Right now they're virtual, but we definitely are going back to face-to-face. I think that's an important piece, and we all feel that's important to do the face-to-face with that. And we review and look at, you read something and you do something, but always that third set of eyes looking at it. You're like, we missed this, or it makes sense to you, but, it's a roadmap and it may not make sense to someone else to get from point A to point B. And then we have the Coalition of Food Protection Task Force. So there's multiple opportunities to support your programs, be involved in your programs, and anything that, if you know some of the states that had enrolled at a later date, they were able to take advantage of the states that had been enrolled in the beginning, because been there, done that. Let's not reinvent the wheel and look at programs that were still compatible or comparable to their program, and they could duplicate some of those SOPs or those efforts without having to come up with new ideas with that. And our next slide, Amy, is on the audit staff here. I'm covering for them, but the FDA Office of Regulatory Affairs audit staff, they've provided this flowchart piece on exactly what the process is. So they have a pre-assessment piece that they have a conversation with you and tell you what they're going to do, provide the information to you of what they're going to be looking at, and kind of walk you through that so you're not, surprised or not prepared for whatever comes with what they're asking for. But as you get into the standards, the state program in the section 0.5 in each standard, out of the 10 standards, 0.5 has specific documentation that must be provided. And if you look at that, that's pretty much what they're asking for. It'll say, you know, provide documentation on how you conduct an inspection, or provide documentation of inspection reports. Those are the pieces of information that you'll be submitting to them. So they perform a desk assessment piece. What they do is you send all that information to them. They review all these sections and they compare that against what is required in the standards through the language in there. And then if they've got gaps or questions and something's not there, that's where they take the notes for themselves, but they perform that desk piece with it. And then they come back and actually conduct the assessment with you. And right now we're doing virtual, or they're doing virtual, and there's opportunities, you know, depending on if you're in full conformance or this is your first assessment, you know, they're looking at opportunities and ways to do things that work for everybody. So it's kind of open right now. Some of the programs that are currently getting assessments are limited because they've met the standards, say 2 times, you know, like in the last 4 years that they are in full conformance. So they're, the audit staff's just kind of doing spot checks on them now, you could say. So with that, the voluntary corrections are submitted to the FDA. So if they do find gaps with that, they say, okay, I'm going to give you 30 days or 60 days, or ask you when you can, you know, make these minor corrections, or if there's some major work that needs to be done. But they work with you to kind of outline that. They evaluate those corrections. They issue a closeout to you and say, okay, we've identified standard 1, you had this gap. Standard 3, you had this gap. And then they let you respond to that. And then after you've responded to that, if you can correct it, they note that you've corrected that. And if not, you know, they say that you may have implemented the standards, you're just not in full conformance with the standard at that point. So they will issue a draft report to the state program, to the coordinators or the program managers, whoever it's been determined that is going to receive that report. And with that, as I mentioned, you submit that information back to the FDA. They finalize that report. They accept or reject your, you know, your changes, and then they finalize that report, and it has commissioner signatures and so forth, and it is sent back to your state commissioner or program manager, whoever's been identified as your program, to actually receive that letter. And, you know, it's always favorable, it's always good, and it's very supportive. But that third person out there having that audit, because if you've got DSI that's, you know, supporting you, coaching you, helping you, and then yourself, that third set of eyes, once again, as I mentioned, the DSI is a third set of eyes to you. The audit staff is a third set of eyes to the DSI, to FDA, and to the state program, to make sure we're all on the same page and we're functioning correctly. And that, you know, with us supplying you with resources, it's always nice to have that third-party person look at you to just have that check and balance for the O&B process. Next slide, Amy. And with that, I believe it goes over to Pat. So.
Yeah, it does. Thanks, Tressa. Appreciate that. So good afternoon, everybody, again. So just want to give everybody a kind of a high-level overview of the Alliance itself and some of the resources that are available to you through the Alliance and through some of the portals that AFDO maintains for the Alliance. So again, the purpose of the Alliance is really to serve as a structure for manufactured food regulatory programs to provide recommendations to FDA and the PFP for improving and maintaining the standards, and for, you know, manufactured food regulatory programs in general. It serves as a forum for communication and collaboration and training to help state programs and manufactured food programs in meeting the standards and in developing their staff. The Alliance was originally formed under the Alliance for Advancing a Nationally Integrated Food Safety System Cooperative Agreement that was awarded to AFTO. And we've continued to work with members to develop that and move that forward. So together, the Alliance and FDA, what we work on establishing a network of state manufactured food programs and managers. We conduct a variety of surveys, as many of you are probably familiar with. We identify and track state law and regulation changes, which helps us give you information as you're dealing with that within your programmatic areas. We put out guidelines and best practices. We'll identify, potentially pilot programs that we can work with states on. There's a lot of community relations and networking and training and outreach, as you know. And then we work to update and enhance the directory of state and local officials, so you have good lists of contacts to get in touch with folks. And we work with FSMA. In support of FSMA, we work with FDA to establish, partnerships that assist in capacity building of state and local agencies, as well as establishing and implementing strategies for improving their food safety efforts. Next slide, Amy. So a little bit about the board. So board members, we have 6 regional representatives that cover the geographic areas roughly that match up with AFTO's regional areas. And we have 1 member at large that provides representation for all the enrolled states. You can see all of our current officers here now. Board members are elected to serve a 3-year term. They're elected by their regional voting members. So the state program managers in each region will vote and select, their representative for the board. In the case of the member at large, of course, all the voting members vote for that. We do have these positions staggered, so we don't wind up losing the entire board all at one time. And we'll occasionally have to, fill a vacant position as somebody moves on or gets promoted to another position and leaves their current role in the program. We do have a chair and a vice chair. The chair, is selected each year. They preside over the meetings of the board and the Alliance. They work with AFTO to support the Alliance. They'll recommend committees and members for committees, and they'll help develop the agendas for the board meetings. The board does meet on a monthly basis via webinar, and then we also try to meet face-to-face, at least at the Alliance meeting, although that's going to be virtual this year as well. And then our vice chair, of course, covers for the chair when they're unable to participate. They assist in assignment of standards change proposals to the work groups, and they'll do other duties as they're assigned. They'll pick up and jump in. Once the chair, once their year term is up, the vice chair typically moves into that role, assuming that their term in office is still going out for the next year, and then we'll get a new vice chair selected that will come in behind them. So that's typically how the board members are operating. Next slide, Amy. The board also has a variety of technical advisors. You can see who some of them are here. We've got 2 advisors from FDA Office of Partnerships from Divisions of Standards Integration. That's Guy Delius. He's replacing Priscilla Nees, who took another position over with the integration staff. And we also have Michelle Motzinger from DSI. We have 2 advisors from the audit staff. Both Ellen and Don currently are participating in the Alliance board. We have 2 advisors from AFTO, myself and Steve. Again, we help kind of manage the programs and help do the tasks, the day-to-day tasks, so that the board members don't have to do all the heavy lifting by themselves, because they do have day jobs. We have 1 advisor from the state laboratory, and that's Maria Ishida from New York State Ag and Markets. And we have just recently, in the last, I believe, year, we added a MFRPS coordinator position as a technical advisor to the board. They were selected by all the coordinators. And Cassie Mueller from the Minnesota Department of Agriculture is the current coordinator. But that way we have that voice on the board as well, that then can identify some of the things that maybe coordinators need help with and resources for, so that we make sure that we address those as well on the board. Next slide, Amy. So just a little bit about membership, because I know this is a confusing point for some folks as they come on. We do have 3 types of membership in the Alliance. And the key ones, really voting members. This one is key because you're the one that's going to be voting on change proposals or anything that comes before the Alliance where we need to vote and make a decision. This is going to be the individual program manager or your management level delegee. So you can't delegate it down to a coordinator, but you can delegate a sub-manager in your program if they have overall management responsibility for, that state manufactured food program that's enrolled in the standards. Voting members can serve as a member or elected officer of the Alliance Board. So in order to be on the board, you have to be in this category. You can participate in Alliance activities. You get to vote on issues brought before the Alliance. Each program, and it's each program, not each state. So each program that is enrolled in the standards gets one vote, when we do bring things up for voting. And again, we use this during the change proposal process, and we'll be presenting all those next week and be assembling probably the voting members in February after the annual meeting to actually vote on those proposals. So it'll be important. We do have 3 states that have 2 programs that are enrolled in the standards. They've got some of the areas that are split between ag and health. South Carolina, California, and West Virginia both have their ag and health department enrolled. So that's why I make that distinction on programs versus states. Non-voting members are any other employee of a state or territorial program enrolled in the standards or an agency responsible for providing support to them. Non-voting members can participate in all Alliance activities. Really, the only differentiation is they can't serve as a board member, as a non-voting member, and they can't vote, obviously, by the name non-voting member. And we have technical advisors. Those are going to be our FDA employees, maybe state employees that are a little bit outside the food program, so like our lab folks. Someone from a territory or AFDO that's responsible for assisting programs in achieving or implementing the standards or auditing the standards for those programs. Technical advisors can participate in board activities as assigned and as non-voting members in all other activities of the Alliance. So they're welcome to come to meetings and all those types of things. Next slide, Amy. So when we think about how does the MFRPS Alliance help you, and again, for the newer coordinators, some of you probably are aware of some of these things, but we just wanted to run down them really quickly so that you're aware. We provide a significant amount of support and opportunity for engagement on issues that impact the standards. Both the Alliance and FDA, jointly host an annual meeting that AFDO helps bring together. It brings together program managers and coordinators, from all of our enrolled programs. And we even invite the other states that are not currently enrolled, to participate in these meetings every year. But we bring together to talk about important issues, collaborate, hear from other state and federal speakers on a variety of relevant topics that we think may be helpful to you to be able to take back to your programs. We typically hold these meetings in February or April of each year. We bounce them around the country, so you don't always have to have it in the same spot. Being in February, folks like to try and go south a little bit, so it's a little bit warmer once in a while. Unfortunately, this year, because of COVID, we are going to be doing our first virtual meeting, and I don't say it's unfortunate that we're having a meeting, but unfortunate that we can't get together. But I think our virtual meeting coming up the first week of February, we've got a really great lineup, and things will be coming together very nicely. So if you participated in the RRT meeting in December, you're probably going to see a very familiar look to the Alliance meeting we have the first week of February. AFDO also hosts the MFRPA portal. And if you've not accessed the portal, you definitely want to do that. There's some really great resources and information for you there. It provides a variety of resource materials, best practices. You can access MFRPA board minutes, standards, the appendices, change process procedures, as well as the proposals that have been submitted and the responses from the work groups. You can access it through the AFDO website at www.afdo.org, and then just select MFRPA portal. If you do need a login, if you are not currently an authorized logger inner or user, real easy to get access. If you are working in a state food program, it's guaranteed. You just need to reach out to Amy Bonsell, and you can email her at abonsell, BONSELL, at afdo.org. That's again, abonsell, BONSELL, at afdo.org, and she will be happy to establish access for you. You log in, and then you get access to all that great information. And as you get into there, you can actually see in the top left corner, the first link you're going to see is an index of shared documents. And this is a huge repository that we've built of procedures and best practices that have been collected from you, all your state programs around the country, on all of the different standards. So inspection procedures, compliance procedures, you name it, we have collected procedures and documents for all the various standards. So if you're looking at updating any of your procedures, or you need information about how another state's doing something, this is a go-to place, because you can access these on demand. and go through them and see them. I certainly can say, as when I was a program manager, I utilized this resource as we were updating our procedures. I was always interested in seeing what what new new method or process somebody else had come up with. I was certainly not above ripping that off and using it as my own. I always said if somebody else came up with a great idea, I'd love to use it in my program as well. So lots of great information there that you can grab onto. And again, we've got all those documents. We have change proposals and recommendations posted there, so you can get access to all that information, including all that historical documentation related to those. The Alliance also manages our change proposal process. I mentioned we use that to make change recommendations to the standards to FDA. FDA does own the standards, but they are always been very interested in receiving that input and recommendations from the state programs, because we obviously have to implement that as the boots on the ground. We periodically open up this process. Typically, it's about once every 3 years. We've been doing it a little bit more often, more recently, simply because we've had some work groups that have been working on some FSMA issues that have been developing them. But the open process where members can submit proposal change requests and ideas is going to be on a 3-year cycle, because that's the 3-year cycle FDA has to follow for Office of Management and Budgets. And it's quite a process to update the standards, and they have to be posted in the Federal Register and all that. So normally it's going to be a 3-year process. So this kind of going forward will set the first year of that, and then it'll be probably 3 years after this. We'll continue to do that. We can bring them in earlier if we need to. But the proposals come in, we evaluate them, make sure that they are related to the standards at the board level. The board assigns them out to the work groups, and we have standing work groups, which you all are welcome and encouraged to participate in. We'd love to hear all of your voices on there and get your input as to how these proposals will impact your program. The work groups kick them around. They talk about the merits of them and the workload associated with them, the benefit of them, and if it's going to be something that's appropriate for the standards. Many times they may do some minor word tweaking of them to get them to a more workable situation, so they're not too narrow or too specific, and allows flexibility so that they can be applied across all 50 of our state programs should anyone want to use them. They're then recommended to either move forward or to not move forward, and we will present those if the board approves that. Then they get presented to the membership. And we have a webinar set up next week on the 19th to do that. So you'll get to preview all the proposals that were submitted and the status of those that will be recommended to move forward to the voting members, and those that were not, and why. So definitely tune into that if you have that opportunity. And then we'll set up voting after that in like I said, mid-February, after we get past the annual meeting. We also develop best practices and other resources. Again, those are available on the MFRPS portal. And last but not certainly least, the Alliance serves as that forum to assist your programs with issues you're having with the standards implementation or with interpretation of the standards. We encourage you to reach out to your regional representatives with questions or concerns. They're there for you. They do periodically send you email updates that, kind of on big issues that are going on and things that are coming down the road that go out to program managers and coordinators. So keep an eye out for those. We try to send those out at least quarterly, but you can always reach out to them. Or you can reach out to, to us at AFTA, to myself or Steve, or to, to any of the folks at DSI, Tressa or Guy Delius, or any of those that are available in DSI. And each state has their own DSI representative, so you're certainly welcome to reach out to them for help as well. Always willing to help you. Next slide, Amy. So a couple key resources just to highlight for you. Last year, our coordinators actually got together and just did a wonderful job of assembling a coordinator's manual. They took, a wealth of knowledge from, their experiences as developing the program standards within their state, developing their procedures and implementing their programs, the hiccups that they had, the choke points or pinch points that they had. Those are all things that they put in there for you. So it's intended for new coordinators. As you come on, make sure you access that. It's there on the MFRPS portal for you to pull down. But it really breaks down each of the standards and really highlights some of those key responsibilities for you. Also highlights some of the challenges they had and how they may have overcome them and what you can look out for and things you might want to consider. So great resource for new coordinators. We also have a resource binder, and don't be fooled by the name. It's not in a binder anymore. We're electronic. We just haven't updated the name. But it's virtual. It's there and accessible on the portal. It's really just a place where we've consolidated some key links for you To get older versions of the standards for the MFRPS program standards, you can access the other standards like animal feed and the retail standards. We do have procedures there, recommended change to standards and a lot of other useful resources. So it's just kind of a one place you can go to kind of get links to other things to be able to pull down. And you can also download copies of the standards. We have downloadable versions of the standards and, more importantly, of the appendices. So you do not have to try and convert them from a PDF document. We have them there in formats. If they are in PDF, they're fillable, or they're in Word or Excel, so that you can utilize them in your program, and just makes it much easier for you to modify them, and you don't have to reinvent the wheel and recreate that. And our next slide, our last one I wanted to touch base on before we'll open it up for some questions. If you are new, we do have some mentorship opportunities that are available. And again, this is going to connect new coordinators with a seasoned coordinator to really just have someone to bounce questions off of and help them as they assume their new role and responsibility. The board and DSI staff are currently putting together a formalized procedure, but we can still connect you up in the meantime with somebody if you're interested in doing that. Maybe eventually, once we get past COVID, you might even be able to do a site visit and go there and actually see some of the things in the documentation and how they do business. We know we've had some states that have done that, and it's been very helpful for their coordinators, but you can certainly do this virtually as well. Best part of it, it's free unless you decide to travel there. But ultimately, this is a great opportunity for you if you want to get connected, connect your new coordinator with somebody that's a little bit more experienced to kind of help them get the ropes of their new job. So with that, Amy, we'll go to our question and answer slide and open it up for any questions from our participants. That's our high-level overview that we provided, but if there's anything that we can answer or that didn't cover, or if we said something that sparked your attention, you want more information on, then we'll let you either throw it on chat, or I guess you can raise your hand and we'll try to recognize you here.
Pat?
Kathy.
Yeah, Kathy Martin here. I'm the newly inducted MFRPS coordinator for Michigan. And what a great presentation and a wealth of information. I'm glad you're recording it so I can listen to it again, because the more I go over this, the more I learn. So I just have one question, and this is the question I have was triggered by a comment that I had from one of the drivers for our self-assessment. And that is for the self-assessment worksheet for each of the standards, the one that ends in point 1. I was discussing this with my driver, and then that driver came back with, well, no, that's just whether it's we have it in writing, that we have that doesn't mean that we're implementing it. But yet at the actual standard there, a self-assessment worksheet, there's very specific sections that says, does the state program have written procedures? But then they go that, does the state program require each inspector? And so when it says, does the state program require each inspector, we have the info down below written into our policy or manual, whatever it refers to. But what if you aren't meeting it through implementation because you found that through the self-assessment? So I guess I'm going to still go back. Does that self-assessment worksheet only apply that everything is in writing? Or do you take that no, we aren't following that because COVID affected us? So I would wonder, how do you approach that?
Tressa, you want to try that one, or you want me to jump on it?
Sure, I'll answer that one. So that's a perfect example that you've identified a gap. So you put that on standard 9, that you identified that is a situation. And when you're to the audit piece with that, what they do is they give you recognition that you've identified that gap and that it is something that you're working on. So it may be that you're needing to update an SOP, that you're needing to develop an SOP. So that's a good thing. And don't ever hide any of those pieces, because that's exactly what the intent of these standards are, is to let you identify those pieces and develop and work as a group and fix that. So put that in your standard 9 in your strategic plan, and it's an opportunity to work on something, and that's where you apply for resources, because that's an opportunity that you're improving your program.
Absolutely.
Okay.
And I think just to add on to that just briefly, Kathy, I think as you look at those, the intent of them is not only that you have the written procedure. I mean, if we take COVID out of the picture, the intent is not that you just have the written procedure, but that you're implementing it. So that may be a gap. If you do that and you find it, and that's one of the things, if you think about standard 6, when you come back, you have your procedures, right? You're going to do your appendix 6.
Right now. We're doing this.
Amy, can you mute folks? Thanks. So as you're looking at 6.1, will require you to go ahead and have that procedure, but then you're going to come back and self-assess on it, later, not self-assess, but do your conformance review on it and make sure that you're actually following that procedure. So the intent behind the self-assessment is not only that you have the procedure, but that you're implementing it. And that's one of the things that audit staff actually look for, is they look for implementation. So if you have a deficiency, you find out they're not implementing it, you put that corrective action in place for any of your program areas, you put it on your improvement plan, and then you correct it. So if it's found during an audit rather than self-assessment, the audit staff's going to actually see not only did you make the change and do the correction, but that you've actually got a period of time now where you've implemented it. So just simply making a procedural change is not going to get them to sign off. They're going to want to see that you've actually implemented it for 30 or 60 or 90 days, and I forget what the number of days is. For that, but they'll want to see that you've actually taken that change and you're actually putting it in play, not just putting it in writing and not doing anything with it.
Wonderful. Thank you.
Great question. Any other questions? We got a question in chat. Has COVID affected states' abilities to fully meet some of the standards? If so, how does that affect their audits? And the answer to that is yes, it has absolutely affected some of the standards, especially their field inspection audits. I saw Matt Colson on the line, and he's not one of our speakers, but he is one of our audit staff. Matt, you want to chime in if you're listening and answer how we're handling those COVID-related inabilities to complete the requirements of the standards this year?
Sure. Hey, Pat. Hey, everybody. So that question has come up, and back in the summer, I think it was in July, the audit staff was asked to put together a memo kind of specifically regarding the field inspection audits, because a lot of folks are not out in the field doing any kind of trainings or audits right now. So, I mean, basically we outlined several different ways that that could be handled. We would be looking to see that you recognize that whatever time frame was missed, whether it be a training time frame, somebody didn't complete their 2 training evaluations within the year, or whatever it was, or didn't complete their basic training on time, or the field audit piece, the 2 and 36 months was missed, whatever the time frame was, that you recognized it, you documented it, and you said what you were going to do to rectify it. Whether it be just you're going to be Zoom auditing whenever things get back to normal, or whatever that is. I just ran into this last week actually for an inspector. Actually, this wasn't even COVID related. The person was out on an extended medical leave prior to COVID. He's back now, but they can't finish the training because they're not out in the field. So basically, the way they resolved it was they basically put a memo together saying that they would get them taken care of once they return back to regular duty. So there's a number of different ways that it can be handled. We're just looking that you identified it and how you're going to correct it.
Thanks, Matt. Yeah, most common is probably just going to be dropping it on your strategic improvement plan, as another element that you need to follow up on and do that. So absolutely, yeah, everyone understands, especially with COVID, that there's going to be some glitches in the system just because of the changing operations we have. Another comment in chat here. I believe FDA has prepared and offered a memo template that we can use to document missing field audits or work. Yes, they did. Michelle, thanks for that. They did, as Matt mentioned, in July, Ellen put out a short memo which detailed how that could be documented, so we can make that available if you don't have a copy of that. And then Kathy's asking, is audit information in writing? Which audit information are you talking about? You talking about the methods that the audit team does their audits? Yes, I think.
Yeah. No, for this year due to COVID, the suspension of holding us to that because COVID affected the audit cycle.
Yeah, so there's no specific suspension of it. They're just basically saying that as long as you have documented, as Matt indicated, that it's a gap, everyone understands, as long as it's been documented and recognized, and so that it's not falling through the crack and been lost, that you're not going to get a audit finding as a result of that. So as long as you've documented in a memo, you documented in your improvement plan, so it's not lost and they didn't just find it dangling out there somewhere and nobody knew about it, then they recognize you did what you're supposed to, right? You self-assessed yourself, you identified your gaps, you put that improvement in place, and you got somebody tracking that and making sure that that stays on track. So that's what you'll have there. And any other questions? Great questions, by the way. All right, well, not seeing any other questions. You can always send us additional questions offline if you like. You can send them to either Amy or myself, and we'll get them to the right person to get you answered if you don't want to answer or ask your question on here. This is our first effort at doing this. We'll probably shoot out just a really short, maybe 4 or 5 question survey next week, just to get some feedback on the course, on this particular webinar, and what we can do to improve it, because this is something that we want to be able to do on an ongoing basis as we have new coordinators and new managers coming online, to just kind of orient them to the standards. So we'd love to have your input on how we could improve this. So at this point, we're going to go ahead and end the general session. We'll ask the managers to stay on. We do have just about 3 or 4 slides just to go over with you, just on some key management points that we'd like to make. And we appreciate everyone joining. Thanks very much. And like I said, any questions, shoot us an email. We're happy to get that back to you, and just be on the look for that real short survey. We will make it really short. So just please take a few minutes and help us improve this so that the next generation will get the benefit. Thanks, everybody. And we'll talk with the program managers here momentarily. All right, so Amy, we go ahead and go on to the next slide. All right, so thanks for hanging on the webinar. I know you guys are very busy, so we'll try to make this brief. We hope you found the overview we provided beneficial, kind of give you that executive overview and kind of high level detail of the standards and what the requirements are for your programs. We're going to take just a little bit of time and discuss some of the other key feedback we've received from program coordinators over the years, challenges they've had, pinch points they've had in being able to efficiently and effectively do their job. So we thought making this information available to you may help you put some ideas in place, or some programs in place in your area that will maybe eliminate this and make it a little easier for them to get things done. So Amy, next slide. So again, these are the challenges of the pinch points that they've been identified. We recognize that not all these may apply to your program or the way that you guys operate, but we figure we'll throw those out for everybody just so that you have that institutional knowledge about it. A lot of times it's really coming down to asking for your leadership and assistance and helping the coordinators get their jobs done, so that they can be effective in their roles. And of course that makes you successful as well, because then when you get an Fda assessment, then you come off with flying colors, come off much stronger, and are gonna pass easier. So one of the first ones is our coordinators need management support to be able to bring potential concerns or problems to your attention. Maybe consider having a one-on-one meeting periodically with them. Maybe it's once a month, or maybe it's once a quarter, or make sure that they know that they can bring issues or updates to you on when needed. Maybe if you have a standing program manager or supervisors meeting, maybe bring them in for an update there. That way, if there are issues, it can be brought to the group for all the managers and supervisors to talk about and resolve. So really the key point here is that communication with management to make sure that they're able to get those issues back into you so they can be addressed. It's a challenge. The reality is that in many cases, they're telling supervisors and other managers, hey, I need this from you. I need you to do this. I need you to assign Johnny to go to training. And they really can't, because most coordinators, as we know, in many states are not supervisors or managers. So while they can tell them to go do something, they can't make them go do it because they're not the boss. They need you if somebody's going to be resistant to doing those things to actually step in and help them get those things done. Keep your coordinators in the operational loop. This is going to help them plan for required trainings for staff field evaluations, and help ensure they can get prompt changes to SOPs and operational changes done once they're identified. So if you're going to be changing things about that, they need to update your SOPs so that they're ready for that next assessment and that next audit. Get your supervisors to do those quality assurance checks sometimes and submit the required documentation. I can tell you firsthand can be challenging. I had those challenges in my program. They're very busy, and it goes to the bottom of the list. It's they're worried about all the other things they got to take care of. But the coordinators recognize they're busy as well. But when we delay these activities, like getting the audits completed or submitting required paperwork, it just creates a backlog, and then the paperwork they need to submit gets buried, and it becomes difficult for them to try and find it and get it turned in later. So really making sure that things are done in a timely manner is really helpful. It's also challenging to get supervisors sometimes to assign trained and qualified staff to do advanced inspectional assignments. Geographically, you may have lost your experienced person there, and you need to get somebody in the door just to look at what's going on. We all understand that. We've all been there. But again, sending an unqualified staffer, as we know, to do a really complex inspection really doesn't do anybody any favors. It's not about checking the box. It's really trying to ensure the safety of the food supply and reducing incidents of foodborne illness. And of course, that's going to get you, a deviation mark when audit staff come in if you're sending staff that have not gone to the advanced trainings out to do advanced inspectional work. So that can be a challenge. We know that finding ways around that and to deal with that is always an issue, but just be aware that that can be an issue for you. And it can also be a challenge to get field staff to send in required documentation, just like supervisors, getting them to send in their training certificates, maybe their thermometer calibration logs, if you have them do their thermometer calibration, that's a challenge. So I can speak to that personally. Make it easy for them, get creative, find a couple different ways they can accomplish it. Maybe it's scanning their document and emailing it. Maybe it's just take a picture and text it into the coordinator, or creating a folder on the network where they can drop the file. If they've got a couple different ways to accomplish the job, maybe it's going to be more likely that they'll actually do it. But, again, it's important as well that the supervisor holds them accountable. The coordinators aren't going to run to the supervisor, every single time. But, when somebody starts having, repeat issues and they've asked them 5 times and they just can't get them to submit the single one-page document that they need, they don't, what recourse does the coordinator have, right? They've got to go and try and get some help from somebody. So, making sure the supervisors are also tuned into that helps, just to make sure that the coordinator is not always having to be the bad guy. They're supposed to be there as a resource for the program. Amy, next slide. Understand MFRPS is not the most important program, and the coordinators understand that. You've got not necessarily program, but most important part of your program, right? We've got budgets that are coming in, we've got outbreaks that are going on, we've got backlogs of inspections and other administrative functions. We're getting pulled in 20 different ways as a manager. So we get it, and I think most coordinators get it. And sometimes the standards can wind up at the bottom of the list of things to do. Try to remember that the quality of the work you perform is also paramount, and the program standards help ensure that your program is constantly improving, and that if you identify those problems and deviations early, as Jan mentioned, you can put a corrective action in place. You can do that, and that's much better to do that than winding up getting embarrassed publicly because of something an inspector didn't do during an inspection. The media requested a copy of the report, and now it's, the issue is all over the evening news because the company's involved in an outbreak. So, definitely important to keep that up. And yeah, it's tough, I get it. But always find a way to make sure that stays in the mix. Experienced field staff, again, can sometimes be an impediment to change. You got that 25 or 28-year-old senior, they're going to retire in a couple of years. They've been doing it the same way for the last 20 years, and they don't want to change the way that they're doing something. Yeah, I get it. And that's a problem, though, for new staff, because as you're trying to train new staff, and standardize them on a new way of doing things, having the old staff continually go and do things the old way, which may be shortcutting it or cutting corners doesn't help. And of course, just creates more problems getting the new staff to do what you need them to do. So again, an important place for supervisors to kind of play that intermediate role and make sure that the old guard, while they're still there, are at least moving towards and progressing in the program the way that everyone else is. Set that tone for success. And getting technology challenged staff, kind of in the same regard, on board with some of the new IT projects and the way that you may handle things electronically is challenging. It's important for supervisors to support them. If they need some additional training, recognize that and ask, the right folks, either the coordinator or others, to help them with that. It's easy to let them slide, but ultimately, again, it undermines your process. And when multiple employees start doing it, it starts cascading. And then the other employees say, oh, well, Johnny's not having to do it. Why should I have to spend my time doing it? And then they stop doing it. So, keeping that in tune and getting everyone to do it is always probably the best way to make sure that you have the documentation records you need, for your self-assessments and, more importantly, for your FDA assessments when they start going through everything. And then support your coordinators in their career development. They don't get probably as many opportunities to get out in the field in most cases, to attend trainings or get exposure to field activities just because of the nature of their assignment, especially if they're the only coordinator you have for all of your standards. So keep that in mind, maybe get them out in the field periodically so that they can increase their knowledge and expertise. That's going to help them draft or craft or update your procedures and, hopefully keep your program, kind of at top flight. And our last one on the next slide, Amy, we understand the challenges of keeping key positions covered and ensuring the most critical work always gets completed. It's good to keep in mind your coordinators also assign other responsibilities in many cases. And they might need your help to help balance their work periodically or provide them with some temporary assistance during a really busy part of the year, maybe when you're doing all of your self-assessments so that they don't get overstressed. Providing some of that temporary help is a good way to cross-train staff because, oftentimes coordinators do promote and move on. We do see a lot of transition in the coordinator position because they become very knowledgeable about the programs and procedures and things. So, keep that in mind, and make sure that they don't burn out. And sometimes, again, they may need some help prioritizing, knowing what to work on first, because you may have some pressing issues that need to take precedence over that. And I think them understanding that, then they can take a half step back and not worry about, trying to chase down documentation or anything. With that, I'm going to just take a few minutes and open it up to our other board members that presented today and see if they've got any other words of wisdom for you as new managers to help you and kind of help you with your coordinators and help keep them on track. So, anyone else have any other thoughts?
I'll just jump in for a minute. This is Jan from Minnesota. And I know Pat mentioned this already a little bit, but I would just really encourage you to help your coordinators build skills that they maybe don't already have. So maybe they're coming from an inspection position and they know that work really well, but now you're asking them to do more project-based work. So maybe going to project management courses or facilitation skills, leadership. A lot of times there's courses offered for leadership without responsibilities or something like that. That really will help to build their effectiveness as a coordinator. And I know for myself, I really rely on our coordinator, Cassie, a great deal to support program activities within the scope of the standards, but leading meetings and things like that, it takes a lot of pressure off me as the program manager.
Thanks, Jan. Anyone else have any other words of wisdom?
Yeah, if I can just jump in for a second, Pat. I can really relate to some of these challenges that coordinators have because I was a coordinator before I was the manager, and now I'm both. But I did have that one issue of getting stonewalled by other management people when you had requirements that you needed their help on, and they just didn't take it seriously. I finally had to go to Travis Waller, our director, and say, look, I need some teeth. I've got to be able to push these initiatives forward or we're not going to make any progress. And so he provided me an extra set of teeth and, working together and having some meetings to coordinate, we got that issue resolved. but I think it is a kind of a common issue that people have. And, you know, if you can help that coordinator not get stonewalled, it sure helps the program move forward quicker.
Thanks, Rich. Yeah, and Justin offered in chat, if you weren't monitoring your chat, you know, also ask other states what's worked for them and collaborate. Absolutely great idea. You know, that's really, you know, the kind of the cornerstone of what MFRPS is about is, you know, or the Alliance is about, is bringing us together as state programs, you know, as resources for each other to collaborate together and learn from each other. So definitely utilize that or reach out and ask your board member, and they can connect you with somebody if you don't have anyone else. Any other thoughts before we wrap things up here? I know we're coming up to the top of the hour here in the next few minutes. All right, well, any questions from our participants that we can answer? All right, well then I guess we're go ahead and close things out here. We really appreciate you taking the time and joining us. We hope that you found this helpful. Like I said, we're going to send out a really short survey. Promise it won't take you not even 5 minutes to complete. We just want to ask those couple of questions to help us tune this up. Are we on point? What did we miss? You know, was it helpful for you? Just to make sure that we're heading in the right direction to meet your needs, and that'll help the folks down the road that come on board. So we'll appreciate that. We'll get that out to you the next day or two, and if you just give us just a quick second to respond back, we'd really love to hear from you. With that, any other questions, feel free to reach out to your board members. You can, on the MFRP portal, all of their email addresses and contact information is there under the board of directors. So you can reach out to them. You can reach out to me at pkennelly@afda.org. You probably have an email from me buried in your email somewhere. Feel free to reach out to me and I can connect you with anybody. And of course, reach out to your DSI contact person. You know, Tressa's on here, or certainly any of the other DSI staff, or even any of the audit staff. I think I saw Matt and some others might be on. So with that, you know, thank you everybody for participating in our first ever MFRPS 101 webinar, and hope you found it useful, and enjoy the rest of your day, and we'll talk soon. Got the meeting coming up February 1st, and don't forget about the change proposal meeting webinar next week on the 19th, so you can hear about the proposed changes we'll be looking at. Okay, with that, we'll take care. Thanks everybody, and we'll talk to you soon.